Hey everyone, and welcome back for another deep dive. Today we're going to be looking at something that I think is probably on all of our minds as sleep medicine professionals.
Yeah,
And that is the growing world of mobile sleep health apps.
for sure.
It seems like every day there's a new one popping up, and it's hard to know
Yeah,
what to make of them all.
right.
So we're really excited to dive into this article from SleepWorld Magazine called Mobile Apps, the Future of Sleep Health.
Mm-hmm.
Sort of unpack, what's the deal? Are these apps really the future of our field?
Yeah,
Are they friends or are they foes?
right.
Hopefully more the former than the latter.
Yeah.
But let's find out together.
Well, I think that the article highlights just how much this is sort of permeating our culture now.
Yeah. Yeah.
It really is. It cites a statistic that almost a third of adults in the U.S. are already using some kind of sleep tracking technology.
Wow.
Yeah, it's a lot of people.
That's wild. I mean, it really does feel like everyone's trying to get a handle on their sleep these days.
Yeah, and the interesting thing is, it's not just about tracking.
Right.
The article also cites research from the American Academy of Sleep Medicine showing that most people are actually finding these apps helpful.
Really?
Yeah, and not only that, but they're actually changing their behavior based on what they're learning from them.
Interesting. So it's not just, data for data's sake. It's actually leading to some kind of positive change.
2/3 of people who use these apps say they've actually changed their behavior because of it.
Oh, wow.
Yeah, so that's pretty significant, I think.
Yeah, that is significant. I mean, it seems like it's almost like an extension of, what we do in the clinic.
Yeah.
Where we're trying to, give people tools and strategies.
Right.
And these apps are almost like taking that and running with it in a way.
Yeah, it's almost like putting a little sleep coach right in their pocket.
I like that.
Right.
Well, sleep coach right in their pocket.
Mm-hmm.
And, speaking of searching for better sleep, the article also mentions this really interesting tidbit. That sleep is actually the most searched health term on Google.
Wow.
It beats out mental health. It beats out exercise.
Yeah.
It beats out nutrition.
That's pretty remarkable.
I mean, it really shows that people are, actively seeking information and help when it comes to their sleep.
Yeah, I mean, it really speaks to, the growing awareness of how important sleep is to our overall well-being.
Totally.
For so long, it's been kind of neglected, and now it's finally getting the attention it deserves,
Exactly.
which is a good thing, I think.
Absolutely. Now, let's get into the nitty-gritty a little bit.
Okay.
Because obviously, we all know as sleep professionals that consumer sleep technology has its limitations.
Of course.
Right? Especially when it comes to actually diagnosing sleep disorders.
Right.
And the article really emphasizes that, right?
Absolutely. Yeah, and makes it very clear that while these apps can be helpful tools,
Yeah.
they should never replace a proper medical evaluation by a qualified professional.
Right. I mean, we're the experts here. But it does suggest that certain apps can be really helpful as adjuncts
Yeah.
to our treatment plans,
Oh.
particularly for patients who maybe have, some subclinical sleep problems or
Yeah.
those who have already been diagnosed and treated for a sleep disorder.
Yeah. I think that's a key point. These apps can be a great way to support patients
Yeah.
in between visits or to help them stay on track with their treatment plan.
Right.
But they shouldn't be used to self-diagnose or to make treatment decisions without consulting with a healthcare professional.
Absolutely.
And I think the key here, you mentioned limitations, but I think the key here is accuracy.
Right.
The article stresses that these apps need to have reliable measurement capabilities,
Yeah.
or at least be able to integrate data from accurate devices.
Right.
We wouldn't want to be making recommendations based on faulty information.
Exactly. Garbage in, garbage out, right?
Exactly. And that's why I find it so interesting that these apps are moving beyond just basic tracking and starting to incorporate features that are based on proven sleep improvement techniques.
Right.
They're not just telling you how you slept anymore.
Right.
They're actually trying to help you sleep better.
Exactly. And that's what I think is so exciting about this field. It's like it's evolving so quickly.
It is, yeah.
And we're seeing these apps becoming more and more sophisticated.
It's really remarkable.
Like, for example, I was so intrigued by the Sleep Score Labs Doctor's Report feature,
Oh, yeah.
which generates a pretty comprehensive sleep report that almost looks like, a mini sleep study.
Yeah.
And the cool thing is patients can actually share these reports with us,
Yeah,
which I think could be so helpful for understanding their sleep patterns outside of the clinic.
absolutely. It's a great way to bridge that gap between what we see in the lab
Right.
and what the patient is experiencing at home.
Exactly. And, speaking of bridging that gap, I also thought the experiments feature
Oh, yeah.
that's offered by apps like Aura and Sleep Score was really innovative,
That's a cool one.
where users can experiment with different sleep hygiene challenges, like cutting back on caffeine or, adjusting their bedtime routine.
Right.
And then see how their sleep data actually changes.
Yeah.
It's like a really tangible way for them to see, okay, if I do this, this is how it impacts my sleep.
I love that feature. It takes all the guesswork out of it.
Totally.
Instead of just telling people what to do,
Right.
it lets them see for themselves how their choices are affecting their sleep.
It's like empowering them to be their own sleep detectives.
Exactly. Yeah.
And speaking of personalization, I was also really impressed by the daily journaling features in apps like Rise and Whoop,
Oh, yeah, those are great.
where patients can track specific behaviors and see how those behaviors actually correlate with their sleep data.
Yeah, that's so helpful for identifying those individual triggers and patterns.
Totally. It's like having a personalized sleep detective in their pocket,
I love that analogy.
right? They can track, did I have caffeine too late in the day? Did I drink alcohol before bed?
Right.
Did I get enough exercise? And then see, okay, how did that actually impact my sleep quality?
It's all about helping them understand the why behind their sleep patterns.
Right.
Not just the what.
Exactly. And I think that leads us really nicely into this idea of digital sleep coaching,
Yes.
which the article really delves into.
Mm-hmm.
And I think it makes a really great point about how generic sleep advice just doesn't cut it.
It really doesn't. Yeah.
We all know that sleep is a very individual thing.
Absolutely. What works for one person might not work for another.
Right. And, the article cites a study that found that sleep hygiene is actually most effective
Oh, interesting.
when multiple factors are combined,
Okay.
highlighting the need for this really holistic approach.
I like that.
It's not just about, doing one thing.
Yeah.
It's about looking at your sleep from all these different angles.
It's about creating a whole sleep ecosystem.
Exactly. And I think that's where, these apps are really starting to shine because they're incorporating principles of cognitive behavioral therapy for insomnia or CBTI
Yes.
into their coaching features.
CBTI is such a powerful tool.
It is.
And it's great to see these apps making it more accessible to a wider audience.
Yeah. And they're doing it in such innovative ways. Like, for example, SleepScore has this impressive advice engine
Oh, yeah.
that uses users' sleep data, their daily logs, even environmental factors to provide personalized recommendations and education on CBTI techniques.
That's incredible. It's like having a virtual sleep coach right there in your app.
I know, right?
That's amazing.
It's really impressive. And then the article also mentions the Samsung Galaxy Watch,
Yeah.
which uses this really interesting sleep animal system
I love
to
sleep.
kind of categorize users and then tailor the coaching accordingly.
Yeah, it's a fun and engaging way to personalize the experience.
It is. And I think, it helps people relate to their sleep patterns in a way that feels less clinical and more approachable.
Definitely. It takes some of the stigma away.
Totally. And let's not forget about, the really popular meditation apps like Calm and Headspace.
Oh, yeah, those are great.
They're not strictly sleep-focused, but the article actually highlights a study showing that Calm can actually improve sleep-related outcomes
Oh, wow.
in people with sleep disturbances.
That's great to hear.
Yeah, so it really speaks to the importance of addressing the mind-body connection when it comes to sleep.
Absolutely. I mean, we know that stress and anxiety can have a huge impact on our sleep.
Coded.
So it makes sense that these mindfulness and relaxation techniques can be really helpful.
Now, of course, while it's really exciting to see these apps incorporating CBTI principles,
Yeah,
we do have to be mindful of the ethical considerations, as the article mentions.
of course.
They should never claim to replace formal CBTI programs
Right.
delivered by qualified professionals.
Absolutely. These apps are meant to be supplemental tools, not replacements for clinical care.
Exactly. And, it's also important to remember that some users might actually have underlying sleep disorders
Yeah.
that require professional diagnosis and treatment.
Yep.
And that's where, the screening features in some of these apps come in.
That's a good point.
The article mentions that the Samsung Galaxy Watch and Apple Watch actually have FDA-cleared features for sleep apnea detection.
Wow, that's huge.
I know.
That's a game changer.
Right.
That could really help with early detection and intervention.
It could. And then the SleepScore app has validated self-report screeners for conditions like insomnia, restless legs syndrome, obstructive sleep apnea.
Right.
So these tools, they're not diagnostic,
Right.
but they can be really valuable for raising awareness
Yeah,
and encouraging users to seek professional help if needed.
absolutely. It's all about empowering patients to take ownership of their sleep health
Right.
and guiding them towards the appropriate level of care.
Totally.
Yeah.
And, I think one thing that a lot of us have been concerned about is this idea of orthosomnia.
Oh, yeah.
That anxiety that some people develop from obsessing over their sleep data.
Right. It's a valid concern, when people get fixated on every dip and spike in their sleep graphs.
Right.
It can actually create more stress.
Yeah.
And ironically worsen their sleep.
Totally. It's like the opposite of what we're trying to achieve.
Exactly.
But the article shares a surprising finding from a 2022 systematic review.
Oh, interesting.
That despite those initial concerns, sleep apps haven't actually been shown to have negative effects on sleep.
Wow, that is surprising.
I know, it kind of goes against what we thought we knew.
It does.
But the article does point to a 2018 study where participants were given false negative sleep feedback.
Oh, interesting.
And it actually led to impaired cognition and increased fatigue.
Wow. So it really highlights the importance of how that data is presented.
Totally.
And the context that's provided.
Right. It's not just about throwing numbers at people.
Right.
It's about giving them actionable insights.
Exactly. It's about empowering them to make positive changes.
Exactly.
Not overwhelming them with data.
And speaking of empowering changes, the article kind of hints at something that I think has the potential to be truly groundbreaking.
Okay.
And that is generative AI.
Now, this is where things get really exciting.
I know. I'm really fascinated by this.
Me too.
The article touches on how AI could potentially revolutionize sleep health coaching.
Yeah.
And I think this is an area with just incredible potential.
I agree. It's still early days, but the possibilities are really mind-boggling.
They are. It mentions Google's personal health language model.
Oh, yeah.
Which has demonstrated near expert-level performance in personalized sleep health management.
That's incredible.
Can you believe that?
It's really remarkable how quickly AI is advancing in this field.
It is. And some companies like Thrive AI Health, Aura, and Whoop are already integrating AI-powered health coaches into their apps.
Wow, so it's not just a theoretical concept anymore.
Right, it's actually happening.
It's becoming a reality.
Which is really exciting. I think we're on the cusp of something truly transformative here.
I agree. It has the potential to completely change the way we approach sleep health.
Now, of course, with any new technology, there are challenges and ethical considerations that we need to be aware of. And we'll definitely delve into those in the next part of our deep dive.
Yes, it's important to approach these advancements thoughtfully.
Right.
And make sure they're being used responsibly and ethically.
Absolutely.
Yeah.
But for now, I think it's safe to say that the future of sleep health is looking pretty bright.
I agree. It's an exciting time to be in this field.
It is. And with that, I think we'll wrap up this first part of our deep dive.
Okay.
We'll be back soon to explore those challenges and ethical considerations in more depth.
Sounds good.
So stay tuned.
Looking forward to it.
Yeah.
So, before we get into some of the potential challenges with using AI for sleep health, I wanted to touch on something we were discussing earlier.
Yeah.
About, how digital sleep coaching can be such a powerful tool for really extending our reach as sleep professionals.
Absolutely.
It's fascinating to think about how these apps can provide patients with ongoing support and education.
Right.
Even when they're not in our offices.
Totally. It's like having a virtual extension of our practice in a way.
Exactly. It's like having a little sleep coach in their pockets.
I like that.
And the article really emphasizes how important personalization is in effective sleep coaching.
Right.
We can't just offer generic advice and expect it to work for everyone.
Absolutely.
Yeah.
We need to understand, individual sleep patterns, preferences, challenges to provide truly tailored guidance.
And that's where the power of data comes in.
Yeah.
These apps are collecting so much information about how people sleep.
Right.
And when used responsibly, that data can be incredibly valuable for personalizing sleep recommendations.
It's like having a personalized sleep map for each patient.
Precisely.
Something we could only dream of a few years ago.
I know, it's amazing.
And speaking of data, I think it's worth circling back to the topic of orthosomnia.
Yeah.
That anxiety that some people experience when they become fixated on their sleep data.
Right. It's a valid concern.
It is.
We don't want patients to become so obsessed with tracking their sleep that it starts to negatively impact their well-being.
Exactly. You want it to be helpful, not harmful.
Absolutely. Data should be a tool, not a dictator.
I like that.
And as sleep professionals, we need to educate patients about using these apps in a healthy way.
Right.
We need to help them understand that data is meant to inform positive changes, not fuel anxiety.
Totally. The article makes a good point about the importance of providing context and actionable insights.
Yes.
Rather than just presenting users with raw data.
Right. It's not helpful to just tell someone they had a bad night's sleep.
Right.
We need to help them understand why
Yeah.
and what they can do about it.
It's about empowering them with knowledge,
Right.
not overwhelming them with numbers.
Exactly.
And I think that's something we need to keep in mind as we navigate this world of AI and sleep health as well.
Absolutely.
You know, we want to ensure that these technologies are used in a way that benefits patients
Right.
without adding to their stress.
Totally. We don't want AI to exacerbate the problem of orthosomnia.
Right, exactly. Now, shifting gears a bit,
Okay.
I'd love to get your thoughts on the potential role of these apps in sleep disorder screening and detection.
Yeah.
You know, the article mentions that some apps are starting to incorporate features that can flag potential sleep disorders.
Yes. And I think this is an area with tremendous potential for improving patient care.
Absolutely.
For example, as we mentioned earlier, the Samsung Galaxy Watch and Apple Watch now have FDA-cleared features for sleep apnea detection.
I know, that's huge.
It really is. It opens up exciting possibilities for early detection and intervention.
Right.
Of course, these features are not a replacement for a formal diagnosis.
Right.
But they can be a valuable first step in identifying individuals who might benefit from further evaluation.
It's like having a readily accessible initial screening tool for a large population,
Exactly.
which is amazing.
And the article also mentions the SleepScore app,
Yeah.
which has validated self-report screeners for conditions like insomnia, restless leg syndrome, and obstructive sleep apnea. So these tools can help raise awareness and encourage people to seek professional help if they're experiencing symptoms.
Totally.
Oh,
It's
that's
about,
good.
you know, breaking down those barriers
Yes,
and connecting people with the care that they need.
absolutely. And I think that's crucial.
Yeah.
We know that so many people suffer in silence with sleep disorders
Right.
for years before seeking help.
Totally.
And these apps have the potential to change that.
I'm curious to hear more about your thoughts on AI and the future of sleep medicine.
Yes,
I know you're particularly excited about this area.
I am. It's a rapidly evolving field
It is.
with so much potential to transform how we approach sleep health.
Right.
Imagine a world where every patient has access to a personalized AI sleep coach
Okay.
that can analyze their sleep patterns, provide tailored recommendations, and even adjust those recommendations in real time based on their sleep data and lifestyle factors.
Sounds like science fiction.
I know, right? It's incredible.
It's like having a 247 sleep expert in your pocket.
Exactly. And the article even mentions Google's personal health language model,
Yeah.
which has shown near expert level performance in sleep health management.
It's amazing.
Yeah.
It feels like we're on the verge of a major breakthrough here.
I agree. And I think the real power lies in the collaboration between technology and human expertise.
Right.
You know, AI can handle the data analysis, provide initial assessments,
Yep.
offer evidence-based guidance,
Yeah.
but it's still sleep medicine professionals like us
Yeah.
who bring the clinical judgment, the empathy, and the understanding of the nuances of individual cases.
I love that. It's not about replacing human expertise. It's about enhancing it.
Exactly.
It's about using these tools to improve our ability to care for patients
Right.
and empower them to take control of their sleep health.
And as AI technology continues to evolve,
Yeah.
I think we'll see even more sophisticated and personalized applications in sleep medicine.
Absolutely.
Just imagine AI-powered systems that can predict sleep disturbances
Wow.
before they even happen, allowing for proactive interventions.
That would be incredible. We could potentially prevent sleep problems before they even start.
Exactly. Or imagine AI tools that help us develop hyper-personalized sleep hygiene plans
Okay.
that take into account a patient's unique genetics, lifestyle, and environmental factors.
The possibilities are truly mind-boggling.
They are. It's an incredibly exciting time to be in this field.
It is.
And for all of us listening, I think the key takeaway is to stay curious, stay informed, and be open to exploring how these technological advancements can enhance our practices and improve the lives of our patients.
Couldn't agree more.
Yeah.
Now, while these advancements offer incredible promise,
Yeah.
it's important to acknowledge that they also come with potential challenges
Of course.
and ethical considerations.
You're absolutely right. We need to approach this technology thoughtfully
Yeah.
and ensure it's used responsibly and ethically.
That's a perfect segue into the final part of our deep dive,
Okay.
where we'll explore some of those challenges and ethical considerations in more depth.
Sounds good.
We'll also discuss what the future might hold for mobile sleep health and its impact on the field of sleep medicine. So stay tuned. All right, so welcome back to the final part of our deep dive into the world of mobile sleep apps. As we've talked about, these apps offer some really exciting possibilities for improving sleep health.
Yeah.
But it's also super important to address the potential challenges
Yeah,
and ethical considerations that come with any new technology.
absolutely. One area we need to be very mindful of is data privacy and security.
Right.
I mean, these apps are collecting highly personal information about sleep habits.
Yeah,
And it's imperative that that data is handled responsibly and ethically.
totally. That's a great point. I mean, we want to make sure patients feel confident
Right.
that their data is being protected and used appropriately.
Absolutely.
Mm.
We don't want to erode trust in these technologies.
Right, exactly. And I think that's, maybe an area that the article didn't delve into as deeply as it could have.
Yeah, for sure.
But it's definitely something we need to be aware of as we consider incorporating these apps into our practices.
Absolutely. Another consideration is the potential for bias in these apps.
Oh, right.
If they're trained on data sets that don't represent the diversity of sleep patterns and experiences across different populations, they could end up perpetuating existing health disparities.
Right, that's a crucial point.
Yeah.
I mean, we want to make sure that these apps are beneficial for everyone,
Right.
not just a select few.
Exactly.
Yeah.
And I think that ties into another challenge, ensuring that these apps are truly evidence-based
Right.
and effective. I mean, there are so many sleep apps out there.
It's overwhelming.
It's really overwhelming.
It's hard to even know where to begin.
Right. And it can be hard for both consumers and healthcare professionals to figure out which ones are actually backed by solid science.
It's like the Wild West out there.
It really is.
I'm encouraged by the fact that the article highlights, the growing number of apps that are incorporating principles from CBTI.
Yeah.
But we definitely need to be cautious about apps that overpromise or make claims that aren't supported by research.
I completely agree. As sleep professionals, we have a responsibility to guide our patients towards apps that are reputable
Yeah.
and align with best practices.
Absolutely. It's about staying informed,
Right.
critically evaluating these tools before recommending them.
Totally.
Yeah.
We don't want to be steering our patients in the wrong direction.
Right. The one final thought I wanted to raise is the potential impact of these apps on the patient-provider relationship.
Oh, that's an interesting one.
Some people might worry that they could create a disconnect between patients and their healthcare providers.
I understand that concern, but I actually see it from a different perspective.
All right.
I think these apps have the potential to strengthen the patient-provider relationship by providing more data points and a shared language for discussing sleep health.
Oh, that's interesting. So instead of creating a barrier, these apps could actually act as a bridge for communication and collaboration.
Exactly. Imagine a patient comes to you with data from their sleep app that shows they've been consistently waking up multiple times during the night.
Yeah.
That's valuable information that can help you understand their sleep patterns and guide your recommendations.
It also empowers patients to be more active participants in their care.
Exactly. They're coming to us with information, not just symptoms.
Right. It shifts the dynamic from passive patient to active participant,
Right.
which I think can be incredibly beneficial
Absolutely.
for both sides.
So where do we go from here? What does this all mean for sleep medicine professionals?
Well, I think it's clear that mobile sleep apps are here to stay.
Yeah,
And they have the potential to really revolutionize how we approach sleep health.
absolutely.
But it's up to us to approach this technology thoughtfully, ethically, and with our patients' best interests at heart.
Right. We need to stay informed, critically, evaluate these tools, and use them in a way that complements and enhances our clinical practice. I agree. It's our responsibility to guide our patients and ensure that these apps are being used safely and effectively.
Well said. I think that's a great note to end on.
Mm-hmm.
By embracing these advancements responsibly, we can really harness the power of technology to improve the sleep health of our patients and shape the future of sleep medicine.
Absolutely.
Wonderful. Well, a huge thank you to you for joining me for this deep dive.
My pleasure. It was a great discussion.
I always learn so much from our conversations.
Likewise.
And a big thank you to all of our listeners for tuning in. We hope you found this conversation informative and insightful. Until next time, sleep well, everyone.